think one of the things that makes Mayo unique and this program unique is there's really opportunity around every corner.
If you are interested in a job in academic hand surgery, it's like no other.
There's no question to me to provide the highest level and the most complex care. It was here.
The best school in the world for surgery.
The depth and breadth of what's done at Mayo Clinic from the realms of patient care, education, and research really unrivaled anywhere else.
The fellowship was everything. My knowledge that I use nowadays, 90% of my practice just came from my fellowship training. It's the foundation for everything that I do today.
There really wasn't a day that went by that I didn't learn something, and something that I could apply to my career both early on and really in many ways I referred back to the training that I had here almost every day in some respects.
I feel like I was very well prepared to enter into practice because of my experience at Mayo Clinic, learning a lot of diagnostic techniques as far as patient interactions, clinical diagnostic techniques, imaging, treatment. I felt very well prepared to meet patients and diagnose their problems, and also to help them along the recovery process with healing.
The hand fellowship helped me in the sense that I had so many good mentors and role models. The breadth of our faculty is so deep that even after I left, I always had someone that I can call in every meeting that I would go to.
They have an open mind and they consider you, even if you are just a resident or a fellow, as someone who can have a brain and give incentive or give new ideas.
The research that you're exposed to here allows you to develop a path so that you can continue that, because it's important once you finish your training to continue learning, because it's just a process that you do throughout your career.
I think it's very clear that the way that we used to teach people in the past is not the way we need to teach now. We have to change, and we've adopted new educational principles to arm the new generation of hand surgeons to lead and be productive in society.
With a facility like this and infrastructure like this, there's ample opportunity to do anything you want. Whether it's lab-based research, whether it's outcome-based research, anything like that. And there's mentors everywhere you look that you're walking down the halls with that know you by name.
The fact that things that when you learn about them in residency seem very complicated or like things that you'll never do, all of a sudden to be doing these things at such a high level with the faculty here, and again with kind of graduated responsibility, is really a very special thing.
There's opportunity around every corner, and really national and international thought leaders in every discipline as it relates to care of the upper extremities. So I think that's what makes this program unique, and I think it's really a well-designed, well-funded, and well-resourced experience.
For me, it was to be the best hand surgeon I could be and to give the best patient outcomes I could give. And to me, there was no question it was coming here to learn from the people that I am learning from.
But ultimately, it boiled down to where do I want to be, who do I want to learn from, who do I want my mentors to be, and where do I want to come from. And when I took all these things into account, the faculty at Mayo Clinic, the types of fellows that have come through here over the years, to me there was no better group of people that I wanted to work with and be a part of, so it was an easy decision.
By the time you leave, there's an imprint from them onto you that you kind of meld all these different things together, and it makes you into the hand surgeon that you're going to be when you leave, which is really the best of what we have to offer here.
There's plenty of hand fellowships out there and they're all outstanding, but when you come here, you're really part of this family for life.